I next want to introduce another one of my colleagues down at the School of Medicine, Federico Velez. And I can refer you to all of his, all the marketing materials online and Google searches and stuff. But I will say a couple of things. Dr. Velez was born and raised in Colombia, and then he trained in Colombia as an ophthalmologist and came to UCLA as a fellow at the world-renowned Jules Stein Eye Institute, and then came and joined our faculty. And what I know him from is just reputation. The word of mouth gets around from in our world about other physicians, and and this is how we all find our doctors. Oh, and do you know anyone who takes care of so and so? Every day someone asks me. Yesterday someone asked me, I need to send someone. My mother was diagnosed with breast cancer. Who would you recommend, etc. And in our craniofacial clinic, I was working in our craniofacial clinic for years, and Dr. Velez's reputation just preceded him before I ever met him. If we had a kid in the clinic with a lot of craniofacial patients who have congenital deformities of the face, the eyes are often involved in some way or another. And we need to reach out to someone to help us take care of these children. And it was always, well, call Dr. Velez, call Dr. Velez, call Dr. Velez. And just, he would see the patients expediently and take care of them. And then the feedback that I would get from the parents when they would come to my office, I'd say, oh, did you see Dr. Velez? Oh, yes, he's such a wonderful person, such a wonderful human being, and I love him, and this and that. And that's very heartwarming to me as a parent, because that's what I want to know, that if I'm sending my pediatric patients to someone, that they're giving the same sort of level of care and commitment to children that I think I have. And it's interesting because I never knew that he went overseas and did this kind of work. And that's how, been one of the great discovery stories of this sort of these symposia that we've been hosting. I knew Dan went overseas, but I've discovered as we all start telling our own stories about global health, Bonnie called me one day and said, hey, do you know a guy named Federico Velez? I said, well, yeah, I know him very well. He sees kids at Jules Stein, and he takes care of all of our craniofacial patients. And she says, well, should we invite him for global health? He operates overseas a lot. I said, well, he doesn't operate overseas. He operates at the county hospital where I operate, and that's sort of like being overseas sometimes. In fact, some of the hospitals I've worked in overseas, unfortunately, are better staffed and equipped than our county hospital. She said, no, he goes overseas. And I said, I couldn't believe it. And that's the discovery of how I learned that Dr. Velez goes overseas. But I think you'll see in his presentation that he also shares the same sort of passion for delivering care to children overseas with a focus on a humanitarian approach to these patients. So it's my honor to present to you Dr. Velez.
I want to thank the organizers, and I want to thank Reza for his very kind words, and Bonnie because she reached me out, and I was very impressed with her Spanish. So it was actually very nice to find out that she was very interested, I guess first because I was born in Colombia and I couldn't speak in Spanish, and I thought actually I was going to deliver this lecture in Spanish, and I was very happy about it, but it seems that I'm going to be kind of struggling a little bit here in English, and I'm going to do my best. And what I'm going to be presenting here, I want to just acknowledge all the other presenters. I just want to say that when you meet people like Bonnie, Reza, and Nick, that we already heard before, is inspiring. We have another person presenting after me, and you're going to see how beautiful the presentation will turn. But what I'm going to present here is a little bit of how we can deliver a very high standard eye care to a rural area of a developing country. And when we talk about developing countries, there are really lots of countries like the one I'm going to present here. I'm from Colombia. I was born in Medellin, Colombia, a world-famous city. And I have a video at the end that actually is going to make it more seriously more famous because it's a beautiful place. And I want to just say that I don't have any disclosures or conflicts. And I'm also very honored to have Dr. Coleman, who is vice chairman in our Department of Ophthalmology. And actually, she came to be here for, I don't know if it's only for my lecture, but I'm very proud to have her here. I want to start with something very simple, is what you have here in this country. Because it's the introduction of what I'm going to present of a person who in Colombia didn't need to do what he did for the people in Colombia. In the United States and around the world, the #1 cause of acquired blindness is cataracts. But in this country, patients get cataract surgery when they can hardly read the New York Times or the Wall Street Journal. Okay? In other countries, people cannot get cataract surgery until they're hitting walls because they cannot see anything. This is a cataract like we see in other countries. Or sometimes we see these cataracts in county hospitals in this country. But this is not what we see in Jules, Stein. And that's the kind of visual loss that you see in a patient with cataract. This is a patient with glaucoma. It's the field of expertise of Dr. Coleman. Those patients lose their peripheral vision. And when the patient realizes that they have glaucoma, it's too late. In this country, patients realize they're losing their peripheral vision because when they're driving on the freeway, they may have some hard time seeing way far beyond. But in other countries, patients come completely blind because the last small piece of optic nerve was completely damaged from the the intraocular pressure, and there's nothing to do. They're blind forever. This is a common disease in the United States, age-related macular degeneration. The treatment that is available these days costs thousands of dollars, something that is absolutely impossible in other countries. These patients have problems with the central vision, and that's what we call an escotoma. You see that you cannot see what is in the middle, but you still have peripheral vision. And it's a problem in this country. But fortunately, for the patients here, they have treatment. Now, what you're going to start seeing on the left side is the standard care of a pediatric cataract surgery in the United States, how we remove it. And if you see, talking about adults, because it's more common in adults, of course, there are about $6.8 billion spent every year in cataract surgery. There are a lot of cataracts that are performed in this country every year. About 3 million cataracts are performed. And the cost of a cataract can be as high as $3,000. Actually, our patients here, Dr. Coleman has more experience because she operates adults, they request some special intraocular lenses that actually cost those patients out of the pocket because it's not covered by their medical insurance, another $1,000, $2,000, $5,000. Patients request to have the cataract removed with laser that costs another $5,000. And when you go to other countries, as Reza mentioned before, there are patients that only make maybe $30 a month, not even $500 a year. So you have to probably collect a whole family of 10 people to remove one cataract. So now, this is actually taken from a lecture, not my lecture, so I give total credit to the people there. And it's what happened in Latin America. It's still the main cause of blindness in Latin America. And a lot of people get cataracts, but it depends on where you go, then you're gonna see the cataracts are treated earlier and the outcomes are much better. If you go probably to Argentina, the outcomes are better probably because patients are treated much earlier. Most of the patients in Argentina are concentrated in Buenos Aires. There are more ophthalmologists in Buenos Aires, in the city of Buenos Aires, than probably in the entire country of Colombia, just in one city. Now, there are also outcomes. The outcomes depend on where the cataract is operated on. And it's been actually, I know that there are a lot of trips to Guatemala from Reza and Bonnie, and actually in Guatemala, the outcomes are not so good, and not that many patients get cataract surgery. Why? Because patients don't even know that cataracts can be treated. All right. Now, A lot of people get older than 50 years, and we know that happens also here. And those are the patients that will get cataracts. And the incidence of cataracts in patients older than 80 years is more than 50%. And we're talking about a disease that you can remove the problem and the patient can recover vision. This is very interesting. If I take all these numbers that are on the far right for you, if I add all those, that's actually, and those are all the countries in Latin America, that will never even reach probably 10% of the cataracts that are removed in the United States per year. We're talking about from Mexico all the way down to Argentina. And what happens is that not that many patients can get cataracts removed in Latin America. There are still ophthalmologists performing, but you can see the numbers. The numbers are very low. Okay, and the numbers of ophthalmologists, as I mentioned before, there are enough ophthalmologists, but there are not enough ophthalmologists performing cataract surgeries because the patients cannot access treatment. It's too expensive for them. All right, so now let's go to the story. This is Colombia, right? And Colombia is a little bit bigger than California, but it's definitely way smaller than the United States, about 8 times smaller than the United States. And the population of Colombia is about 1/10 of the population of the United States. Now, Colombia has 47 million people, and the density is definitely less than California. California has about the same population of Colombia. I look at the ethnicity. I mean, is there anything, that makes Colombia different from other countries in terms of treatment? And in reality, it's not. Of course, we have some, because we're colonized by the Spaniards, the combination of native Indians and the Spaniards created the mestizos, which is probably the most important population of Colombia in terms of ethnicity. And others are pretty much similar to what we see in other countries. That's not the difference on really the treatment, but it's probably in terms of the incidence of cataracts, but it's probably what decreases the access of medicine, because lots of these patients, the mestizos, they actually live in rural areas that have no access to medicine. In Colombia, about 70% of the population live in cities. But when you talk about cities, you're thinking about capitals. It's not really the truth. Most of the Colombia cities are actually small cities in rural areas, and they have no access to ophthalmology care. So only the big capitals will have hospitals with ophthalmologists, and most of the hospitals, county hospitals, if you want to call county hospitals, don't even have ophthalmology access. It's really private hospitals that can offer the treatment that we offer here, even in our underserved areas. So there is a place, unfortunately the video is not going to have sound over there, but this was actually in English, and that's what I put it. So I'm going to just lower, because the story of what I'm going to talk starts in this city. It's called Bucaramanga, Colombia. And in this city, there was a visionary. And I'm going to talk about this person in a little bit. I'm going to advance this video, because there is a person, I think who is this gentleman? His name is Virgilio Galvi. So what is the story about this person? So when you heard Nick talking earlier, it's kind of the same story, okay? This guy was the son of a very powerful person in the government. His dad was Secretary of State, ambassador in many countries in Europe, owned in the country about 10 newspapers and the cable television. Just Mr. Turner, okay? Just think about that. And he was a professional golfer, winning tournaments. He didn't need to go to medical school. He could have an easy life. So he decided to go to medical school and be an ophthalmologist, thinking about easy life. And then he decided that he wanted to create an institution to offer treatment to poor people. So the only access was to go to a county hospital and ask them for an office where he could put his instruments, including the slit lamp and an ophthalmoscope, to check patients that have no access to medicine. So they gave him a small office. He had money, so then he decided to buy a house. And he bought a house, and he put his office in this house, okay? He wasn't happy enough with this, so he decided that the best was to build an eye institute where he could have two different doors. The people who could pay from one door, the people who couldn't pay the other door. The good thing is that the two doors joined back the door. So they didn't know how much they paid, but they got exactly the same treatment. The ones that went through the door that didn't pay anything, they were actually received by social workers. The other ones were just received by accountants, pay and go, all right? And then he wasn't happy, so he decided that he wanted to build a much bigger hospital. And this was a hospital where I did my residency. So when I came, this was the hospital, and he was a visionary, so he actually looked for a person not as wealthy as Carlos Slim, but really one of the wealthiest persons in Colombia. And he said, well, I want to put this hospital under your name, but you have to give me money. And he gave money, and he finished the hospital, but he wasn't happy. So then he built another hospital, and this hospital is actually quite big. It's probably as big as Ronald Reagan. And it has all the super specialties, but with a special attention to ophthalmology. And still, patients without access to medicine can come here. And this hospital has a hotel, has a conference center, has everything. But patients that have no access to medicine can still access medicine here. So, and this is actually him on a helicopter being very proud of his new hospital, right? That's why I put it here. But he wasn't happy up there. He said, well, actually, this is very interesting. His hospital is on CNN News. I found this video where in CNN, they actually put his hospital because his hospital offers medicine to patients from the United States, patients from the Caribbean, patients from all South America. They go to his hospital to be treated. So the story about how to treat patients in underserved areas starts here. So we in Jules Stein have something similar to this. This is just a bus that has, goes around. And here in Los Angeles, Dr. Coleman actually is the one in charge of this program. He has an NIH grant even to go to different areas of Los Angeles to screen children that can have ocular problems. So what this person did is that created a hospital inside this bus. So this bus has 3 areas. The front of the bus is an outpatient clinic. The middle part is a sterile room, and the back of the bus is an operating room. So we don't really need to have any support from any hospital. We cannot go anywhere, just stop, we're resting. You need surgery, get into the bus and we can do surgery. And that's kind of the way he started moving around. So this bus started working probably in the year of 1980, 90, probably 1990, it started going everywhere. And it's not easy. I mean, you go through very rural areas, there are no freeways, not even highways, not even streets. Sometimes the people from the country have to cut trees and create access for this bus to go. You have to go through rivers. That's the only way you can get to those points where you have to treat patients. And this is actually, there's no power where we go. So you have to take your own plant power just to connect and function. All this is donated by this gentleman. And we we access people everywhere. Now, who are the doctors? This is the most interesting part of this. He, as part of the story, Colombia has a very significant conflict, probably the oldest conflict in the world between different groups. So he decided that to go to some areas that would be very difficult for this unit to go, he needed to have some help from the military. So he decided that the best way, he couldn't just, like a civilian, just go and say, hey, I need some guys over there to help my people to get there, so we have to treat patients. So he decided to go to the reserve army. So he became a lieutenant and then a colonel, and then he could have his own army. And he could tell, I need a helicopter. So he deployed the army in the helicopters, and we take the whole thing, and we take the whole hospital, and these are Russian helicopters. They're huge. You can put that bus and another 3 inside, and we just go, and then we can take the hospital, and we can treat patients over there. And when we say this is my experience as the surgeon. So when you are a first-year resident, you go to this hospital, and you just travel with the bus. You don't need to drive the bus. Somebody else does it, but you go. And you start selecting the patients for the senior resident to come on the weekends to do the surgeries. And the senior resident goes there with no teacher, no attending. It's whatever you learn on the week, you go and practice on the weekend. And hopefully you are gonna do a good job. And this is obviously, we have to do some screening, because when people learn that you're gonna come free to treat patients, then people will, and I'm gonna mention insurance, I don't have any interest, people with Blue Cross will show up as well, because then you can have your cataracts removed for free. You don't need to pay your copayments. We give classes for free. All the examinations and treatment are for free, including drops. And this is the waiting area before the surgery. There's no waiting area, just sit and wait for your turn to be called to get into the bus and just have the surgery. This is the operating room. The only problem, it was really hot, extremely hot. There is no ventilation, there's no air conditioning. So, sometimes you see drops of, thrown in on the microscope. And the other thing is that a couple of times during surgery, the power fell, so there's no power in the middle of a cataract surgery, so somebody has to have a light from the side just for you to finish the surgery. Patients thought that they were blind already, but things work. And this is kind of the happy part of the story. A lot of patients recovered their vision. And there is a video here that I really think I want you guys to see it, because it's very interesting. This is a gentleman that is 80 plus years old. He lives by himself in the middle of the jungle. And he's just a guy who built his own house out of wood, pieces of trees, and he has cataracts. He cannot work, and he's alone. And so he's evaluated, and he's been told, you need cataract surgery. Well, for him to go to this bus, which is what I'm going to show you here next, this guy has to walk 3 days. This is the music that I told you. I have music. Vallenato, so you can start dancing, guys. So anyway, that's Carlos Vives. So this guy has to walk. And I have to tell you, seriously, that I saw this every day I was there. Patients come riding horses, mules, donkey. Patients walk. They don't have anybody with them. They just go, have the surgery, and they just go back. They just go back the same way they come, and they just come back. Every time you ask them to come back for a follow-up appointment, they show up. So this is basically him, and you can see here he's walking into the bus. This actually is taken from the back of the bus. So basically the camera is here in the operating room. We were allowed to bring it. We didn't have Jacob there, so we didn't have any kind of hospital organization looking at us, but it was sterile and it was clean. And basically, his cataract surgery is performed. And the lens that we implant, that I mentioned before, that sometimes can be as expensive as an extra $1,000, they're all donated. So there are organizations everywhere in the world. An intraocular lens here, the minimum cost is probably several $100s. In India, for example, an intraocular lens is probably $10. And in Germany, there is an organization that helps these kind of programs. They're absolutely all donated for free. So that's the way you can actually do these programs, and you can you can offer medicine with the highest quality, with all the equipment, and with exactly the same instruments that we use in Jules Stein to people living in areas that have no access to medicine whatsoever. This is the last part of my presentation. That's actually the hospital. So not happy with just doing the treatment of patients in his local area, his own state and some states around, he decided that the best was to create a teaching course for physicians in Latin America. We've done it 8 years in a row for 2 weeks. So during 2 weeks, we have physicians. And when I say physicians, include medical students, include ophthalmology residents, ophthalmologists with fellowship, who come to this institution for 2 weeks. During those 2 weeks, they stay at a resort with pools and tennis courts and golf courts, and all the food is provided, 3 meals a day. They stay in a very convenient hotel just for them to be trained with the last technology and the highest standard of care. So all the participants, including the students, get the same training on techniques for examination, surgical techniques, diagnostic testing, and that's what basically we do the first 2 weeks, the second and the third week of January. And this started the same way this guy started this whole thing. We were talking at a meeting, and I told him, I want to create a pediatric ophthalmology course at your institution, and we're thinking about maybe next year. This is on a Friday in September, 9 years ago. And he told me, why is only pediatric ophthalmology? I said, well, because that's the only thing I kind of know a little bit. And he said, well, why don't we do a whole general ophthalmology? And he said, well, but it's impossible, it's too short. He said, well, let me think about it. This is Friday. On Monday, he already have the dates. He already have teachers coming from Europe, Argentina, Mexico, and of course from Colombia. And he included me. And since then, we have 500, 600 doctors in these 8 years who have participated of this training course. And that's kind of what I think is the most important, because it's not only treating the patients, but it's telling those doctors what you can do when you go back to your own countries. That was the last part of my presentation. We're done, right? Do I have 2 minutes?
Yeah, sure.
All right. But the problem is, I'm going to put the microscope here, okay? I told you that Colombia is very interesting, okay? So here we go. This is actually a video that is very, very interesting. Let me see if I can put the volume up.
There's a place where people never believed impossible was a word. A place where the rivers wanted to be an ocean, and the ocean grew weary of its solitude and joined the waterfall, the mountain, the snow peaks, and even another ocean. A place where the past lives harmoniously with the future, and the word infinity is written on the colors of the beach, the mountains, the jungle, and the sky. A place that challenges the imagination every single day. A place called Colombia. No one can imagine what Colombia is like. The sea really has 7 colors. Where the angels go on vacation. The beauty, the variety of animals, the energy of the river, the jungle. The adventure of my life. A walled city open to the world. Without knowing, you fall in love. You feel close to the sky. In fact, you are in the subsidiary of heaven and the Salsa's capital. A paradise where whales come for vacation. It's magical and full of colors and contrasts. A place that surprises you every day in a different way. The city that blooms and never goes out of fashion. The city of the everlasting spring. A country full with history and culture. Where you arrive one day and when you leave, you know you must return. A country of people who welcome you with open arms and a cup of coffee on the table. Catch captures the passion of the Colombian people, the people you always want to have close by, the most beautiful people in the world. You feel alive, and you realize that Colombia is not what you thought it was. A place where you will be surprised every day in a different way, where reality can be magical, and where happiness is just around the corner.
Colombia.
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 Colombia. The only risk is wanting to stay.
All right, that's it.